Hello, I'm Dr. Greg Nelson, one of the medical directors at Palliative Care, and this is Blair Helgeson, a nurse practitioner who works in the Palliative Care program. Actually, we're both in that program. Our program's kind of divided up between the hospital and what we call our community palliative care program, and we just wanted to talk to you a little bit about that. A lot of people don't understand what palliative care is. Sometimes people confuse it with hospice. It's not hospice, really. In fact, some doctors even confuse it with hospice. But palliative care is a specialized medical care designed to provide good pain control, kind of filling in the gaps within our healthcare system for people with serious medical illnesses. And it's a very difficult thing, and it isn't just symptoms that they have. It affects their spiritual side, it affects their relationships. So palliative care, I guess kind of like hospice, brings a team approach to care such that we try to see the whole patient and take care of the patient and their family. So it's not just like going to the doctor's office. We try to see the big picture and help you in many ways. I tend to focus a little bit more on the hospital and cancer center side. We have a special relationship with KU St. Francis here in Topeka, and so I spend a lot of time there. Blair, though, you're seeing patients in the community. What does that look like when you're out seeing patients there?
Yeah, the community palliative care program can happen in either of two places. First, we will see patients certainly at our clinic on the Midland campus, or a lot of my patients I will go to their homes as they have trouble getting out to see a normal provider. And so I'll go to their homes and speak with them and their family members and caregivers. And then we also have a wonderful nurse named Laura who works with us, and she calls and checks in weekly or monthly depending on the patient's needs, and just make sure that they're doing all right between visits. So in palliative care, the way to qualify is to ask your primary care doctor, or maybe a specialist like your pulmonologist if you have COPD, for a referral. And then what I do is I look at the information to confirm you have a serious or potentially life-limiting illness like heart failure, COPD. Those are a couple of our really common ones. And if I see you have one of those and it looks like you have symptoms that need help being managed, I'll get our first visit scheduled. Myself and Laura will come out to see you, and maybe Dr. Nelson sometimes too, and we'll get a care plan going for you to manage those symptoms.
Yeah, we don't become your primary doctor. We work with your doctor and communicate with your doctor so that he or she knows what's going on. We just try to provide an extra layer of support.
Wraparound care, yeah. If you're wanting palliative care in the community setting, you would call Midland's 24/7 number. You'll get connected to a triage nurse, and you'll just say, I would like to speak to the palliative care department. And they'll either connect you to myself or Laura, and then we can walk you through the rest of the process from there.